nominating committee is working hard to fill, working with the mayor's office, and we are very close to filling the seat that was vacated by Denise Candello when she resigned June 1st, 2023 last year. So we're very close to that moment. The nominating committee is working hard to fill, working with the mayor's office, and we are very close to filling the seat that was vacated by Denise Candello when she resigned June 1st, 2023 last year. So we're very close to that moment, I believe. I was hoping it would be today, but days away, I think. And then Karen Flight, a board member who was with us for 10 years, decided, also similar to Denise, she's living outside the city quite a bit, and in sort of a semi-retirement, and she has decided to focus on Humane Society of America, where she is also on the board, and it's a little more of a national remote organization. So she resigned from our board, sending us all the best and with full support at the end of December, just at the beginning of the year now. So we are in full speed ahead trying to find an excellent candidate, and that member will be a board appointed candidate as opposed to a mayoral appointee. So that's kind of the opening housekeeping announcements. And this is our January meeting. It's our official annual meeting, which is when we establish our officers for the year and we name our committees. And we have a slate of officers that include the chair position, which I put my name forward, Patrick Nolan, Secretary Jay Kuhlman, and Treasurer Jason Power. May I have a motion to approve this slate of officers from the board?
Motion.
And a second?
Second.
And all in favor? Aye. So our officers are set for 2024, and our committees, we have a bit of shuffling, and we have our Executive Governance Committee, which will be chaired by me, Patrick Nolan. Membership is Jonathan, Elaine, Corinne, Neil, and Jay. Our Audit Committee, Finance Committee is chaired by Jason. Membership is Jonathan, Elaine, and myself. The Nominating Committee, I'm chairing it, but I would welcome a new chair for the committee if anyone would like to replace me. But I'm chairing. Neil's a member, Sarah, Corinne, and Christine. And for our Development Committee, Dennis is chairing. Jay, myself, and Jason are members. And our Cleans Committee, Christine is chairing. Jonathan, Adrian, Sarah, myself, and Elaine are the members. Christine, I know you have a lot of great updates for the Cleans Committee. When we talk about the facilities, maybe you could chime in after that with your updates that you would like to. Any questions? Board members, any questions? No? Okay, great. Sandra, we're ready to have our audit status. Hi, Sandra. How are you?
Good morning, everyone. So we anticipate to have the first draft of the financial statement.
Could you speak up?
Yes,
Speak up.
yes, at the same time.
Maybe come up in front, yeah, or over here. Oh, great. Microphone, even better.
Okay. Is that better?
Yes.
Okay. We anticipate to have the first draft of the financial statements by the end of January for management review. By the first week of February, I will be distributing that to the audit committee, and they'll have a couple of days to send their feedback and comments. We will return those comments to the auditors, and they will make any necessary revisions to the documents. By the second week of February, I will have the final draft ready to share with the entire board, and I will be distributing that by email to all of you. So in that email, I will also ask for your availability and some dates to schedule the official where the auditors will present the final draft for the financials and they will request your approval. So look out for an email from me mid-February and just start thinking of some dates that you would be available either at the end of February or beginning of March.
Great, thanks. Jeff and Sandra
I'll come to the front.
are year-to-date.
I'm gonna come.
Excellent, okay.
I need to find you, Patrick.
Oh, sorry, thank you. Yeah, we do need to quickly approve our minutes from the last meeting. May I have a motion to approve the minutes? A second. All in favor? Aye. Okay, our minutes are approved. Thank you. Good to have a lawyer out.
And just to wrap up the audit part of the conversation, then I'll go to mine. So based on the initial suggestions that we're getting from the auditors, I don't think there's going to be any substantive audit adjustments. So there won't be any major changes to what you've seen before for reported financials. The one thing you will see for the first time is, and I think we may have discussed this in previous meetings, there is a new AICPA regulation that deals with how you report leases on your balance sheet. It's the stupidest thing, and I say that as a member of the AICPA, but we have to do it. So there's going to be a little bit of a change where the balance sheet looks for leases, but that should be it. I think there'll be nothing else that's and they've raised no major concerns, so I think it'll be good there. So this part of the meeting is a very quick review of what our balance sheet and cash flow statement looks like for the 6 months ended December. And then we're going to talk a little bit about where we are with fiscal year 24, year-to-date December development. There's the first slide. I don't have the clicker, so can we go to the next slide? I don't know how to do that.
Oh, me?
I don't have the clicker.
Thanks, Katie.
So what you're looking at here is a statement of activity. So the first column is the actual, that's the 6 months ended December. The next column attempts to calendarize the budget, doesn't do it very well, we'll talk about that in a minute. And then to the right, it's actually in blue, I don't know why it's blue, is the prior year results, year-to-date December, that would be year-to-date December 22. So regarding where we are, our change in net assets for the first 6 months of the year is a positive $354,000, so we are in the right direction. Making comparisons at a line level, actual versus budget and actual versus prior year, are a little bit challenging, but I'll attempt to do that anyway. It becomes fairly obvious looking at that top row and then looking at some of the expenses that it would appear that we are underspending our budget. And in some ways, I guess that's true. The situation being that total budget includes several tranches of costs, including a large amount relating to between shelter and moving. So we probably should have attempted to recalendarize the budget, if you will. Basically what I'm saying is we're going to have some expenses in the second half of the year that were contemplated that we didn't have in the first year, but the budget didn't actually calendarize it and it probably should have. So at the moment we have expenses that are under budget. But because we recognize revenues essentially as we incur expenses, that's why the revenue is basically in the same direction. It is less than budget. But some of that delta is going to be picked up in the second half of the year. Regarding prior year, the only thing I'll note, just because it just looks funny, when you see that personnel services line, and it looks like it's gone up actual versus prior year by $950,000, I actually had to research this last night and I had forgotten. We get a CRS pension in-kind contribution. We actually received the paperwork literally on that right before the last meeting this time last year. And so I went and booked it in December of 22. I haven't booked the one for December of 23 yet. So if it's a similar number, I don't know, $1 million, we'll be adding $1 million to the personnel costs and $1 million to the reimbursements. No change to the bottom line, but it'll look a little better to do the comparison. But for the most part, it goes directionally the way you would have expected. Any comments or questions on this? Next slide, please. So the next slide is a balance sheet. And so to the left is, we have a separated balance sheet for the shelter operation and the construction of the new shelter, that's the 1906 Flushing. And then to the right is just a comparison of where we are in December of 23 compared to the unaudited preliminary June of 23. So ACC at December 31 has about $9.8 million of net assets. which again is $354,000 higher than where we were the previous year. The cash on hand is now about 6.9. Of that 6.9 is about $1.1 million that is net assets with temporary restrictions. So at the moment, liquidity is good. From an AR perspective, there's only about 1 month of collections that are outstanding, which is December. So December, there'll be about $1.7 million and change that'll be vouchered. We did receive an advance, like we do every year, about 25% of our budget. So at the moment, the unrecouped budget advances, I think it was $3.7 million for the budget, and then there was an additional $400,000 of Queens equipment, which was advanced to us. Any questions on the balance sheet? And again, here is where I'm saying that when we do the audit, you're going to see 2 new lines that don't exist here. And then going forward, we'll try to figure out what's the best way to account for that, which will be a right-of-use asset and lease liability. But if you're not an accountant, don't worry about it. Any questions? Super. Next slide. So this basically reiterates things I've said before. From a cash flow perspective, you'll see the total cash from operations for the first 6 months. It's about $10 million. $6 million of that related to the construction, but the $4 million, which relates to the shelter operation, almost entirely from the DOH advances we talked about. So I think the total cash from operating is 4.14, and the DOH advances happens to be 4.14. So that's pretty much what you would expect. And we'll start having those advances recouped, I believe, with the January invoicing. So I would imagine February and later is when all of that will start to get repaid. I have, yes, a little bit of good news. We have a Charles Schwab account which hosts securities which have been donated over time. And so through December of 23, we actually received about $45,000 in donations. That's great. And because Risa turns out to be the best money manager in New York, that investment account has actually generated other gains over the first 6 months of an additional $50,000. So just well done. Manage my money.
It's my second job.
So, anyway, that's a healthy cash flow statement for the first 6 months. Any questions or comments on it? Okay, very good. So, do you want to handle the next slide as a development update? Or
Yes, Andrew and I will do it.
Okay, next slide, please. I'm going to hand the microphone to Ms. onto this slide.
Thank you.
Sure.
So Jennifer, our development director, is on maternity, and I work closely with her as the finance director.
Can you use the microphone, please?
Again, Jennifer, our development director, is on maternity, and I, as the finance director, work closely with her. So I will be reading the numbers, and if you have any questions, please, and I can will do our best to respond to those questions. If you don't have to answer, we'll get back to the development committee. So let's start with the individual giving. Last year, by mid-January, we received a little under $500,000. And this year, to date, we are at $583,000. That is a 17% increase. For institutional giving, last year, to date, we were at $1,177,000. And to date, this year, we are at $1,228,000. That is a 4% increase. Event income, last year to date, $285,000. This year, we are at $365,000. That is actually 28% increase over last year, and it's also above the annual goal we have, or close to the goal.
And also, that because we're in the midpoint of the year, that's just the gala. Our
Right.
2 big events, the gala and the spring break, so that's only the gala.
That's great.
That did better than last year, which was what we were expecting.
For requests, last year was a good year. We received $250,000 by January. This year we are at $28,000. It's an 88 decrease from last year, but requests are better.
And I'll just add one thing. Last year was an unanticipated state that gave us over
Yes, that was
So it's one- it
193,000.
was
one big,
Request.
yeah. And then, as we said last year and in June, in terms of requests, we started a very active legacy campaign.
Right.
We sent out to our current donors and our major givers a thank you very much. The brochure, all the board members got it, and we're really working on that to follow up and just get commitments for the ACC legacy gift. And you don't always know, you will not know the amount, it can change over time, so it's really just, do we have a network of people who are interested in giving?
For dog licensing, last year we were at $20,000. This year we're at $20,000. A 27% increase. City council discretionary, last year we received $47,000 for the year, and this year we are approved at $50,000. We won't see revenue in that category until the end of the fiscal year, because that's a vouchering process, so we usually voucher towards the end of the third quarter, and the funds are returned by the end of the fiscal year.
They still can't hear you.
Can I repeat that?
Talk into the microphone.
Okay. Should I
Could you-
repeat treasurer donations?
Could you close the door over here? There was chatter
Yeah,
coming
just-
in, we can't
since
hear.
we've interrupted, is anyone here from HPD parked outside? No, no.
Okay, could you
Thank
close
you.
the door,
Thank
please?
you.
Thank you.
I'll repeat the city council discretionary.
Hold this closer to me.
Okay.
That's it.
Okay, last year we received $47,000 in city council discretionary. This year we are approved for $50,000. We don't usually voucher for those funds until the end of the third quarter of the fiscal year, so those funds will be coming in towards the end of fiscal 24. The New York State funding, that line was actually meant to be separated from this group. It's not included in the 3.2 total that you see here. And it's included in the list because I know the development team is working on a proposal. It's for capital funding for Manhattan. And with capital funding, we don't know if it's going to be received by start of this fiscal year. So that's why it's not included in the total, but it's listed in the works.
Yeah, so we applied to New York State and had this capital, and we want to make improvements in Manhattan, and we got it. That's the amount that we are granted, but there's a long process to get to that.
So we don't know which fiscal year necessarily is going
Correct.
to hit.
Correct.
That's great news that we.
It's a
got it.
two-year, it's a two-year contract. We have until 2025 to send the vouchers, and it's another vouchering thing.
Okay, very good. That's great news.
So overall to date, we've raised 70% of the total annual fundraising budget. I have the numbers below, the total of revenue related to the campaign for the future. Last year, for the full year, we received $176,000. To date, this fiscal year, we have already received $350,000 for the campaign. And in addition to that, we have another $906,000 in pledges.
And as the shelters open, we expect the pledges to become reality. A lot of them are basically naming rights, and we really expect that to grow more rapidly as we open new shelters.
That's all for development.
Any questions?
Any questions?
And based on kind of normal seasonality, is 70% of the full year budget sort of consistent with where you expect to be right now? Because we're tracking in line with and kind of,
I think it's a little better. I think that the gala was the main reason for that increase. The gala did better this year than last year, maybe by almost 100,000.
And remember, December 31, right, which at the end of the tax year shows up in that first half of the year, so we would expect to do a little better that first half, the second half on certain kinds of contracts.
Yeah.
And also the campaign funds.
Right.
So last point, we had $50,000 in campaign funds. This year we were like, yeah, it's about $50,000. Thank you.
There's a slide thing, that's what you think. I don't know how it works. I didn't want to touch that.
Okay.
Okay, Lisa, you're updated now.
On this. Okay, good morning. Let me know if I need this, I prefer not to use it. So, it's always good to see everyone. I really appreciate comments, questions, just being together in person, so that's a real positive. I can't say that a lot is changing from this year to last year. When we look back, our fiscal year is July 1, but this report, the operational report, is calendar year. So from last January to this January, there's some changes, but we're still, I think we've moved out of COVID, and we're not looking at pre-COVID numbers. We're really looking at what is the future, where we're going, and how do we strategize, especially come fiscal 25, when Queens will be open, and Manhattan Pet Adoption Center will be open. Like, that is really part of the conversation over the next 6 months in terms of how do we take what we learned in 2023 and move that into our future strategy.
Yeah.
Okay, so let's just look at intake by source. As you can see, far right is 2023. It's inching up, and the biggest takeaway from this slide is that it's dog intake. We are really busy with dogs and overcapacity as we speak, and that's, I feel like a broken record, but that is what's going on, and it's going on nationally. So it's not like we're an outlier, and it's a problem. It's a serious problem that we are trying to address with so many different programs, and these programs are what other big shelters are doing nationwide. We're always looking for some new and unusual idea, but what we're going to talk about moving forward is sort of where we are in the community and how we can address like what is happening in the community, so that we know our intake. That's what shelter's here for. We know we're going to take animals in. That's our job. That's our contract. But what can we do to understand the community better, the needs, and anticipate what we need to do? Like dog intake in particular, up 730 dogs. That's a lot of mouths to feed. Every animal has to get some type of enrichment, walk, feeding, care, so it really is a big number. And the other thing is, if you look at these numbers, there's a big uptick in stray. So that dark brownish 3,201 is a bigger increase from last year in stray. So what is going on? We've been talking to DOH about doing a much more robust licensing effort. Can we advertise licensing better? For us, it's also a plus because you get to round up and give ACC a donation, and we would love that. But really, the bigger priority is we have to get these dogs licensed. We do have a good return to owner rate. It's getting better. More and more animals are being returned to their owners, but we could do better. We get too many unlicensed, unaltered, stray dogs. Big problem that we need to focus on. We look at the placement rate. Stray dogs are the hardest to place. We do not know their history. We don't like to take a lot of risk and it affects the placement rate. You know, we're still like hovering at the 90% mark, but it is, it's a lot of work. I will point out our new home placement for the past year, really 41%. And we embrace that. And we don't see that as a negative because adoptions nationally are going down. People are having financial problems. People are returning their dogs to shelters for financial reasons. It's expensive to care for a pet. And so you see our adoptions are at 27.6%. That's really a national reflection. We're doing everything we can, and you'll hear more about that in terms of communications. But there's a challenge. There's a challenge, and it's bigger than the shelter. There's a financial crisis happening, and we are here to help the public. So the New Hope Partnership, they traditionally have always taken from us dogs, cats, and guinea pigs, rabbits. They take from us challenges, behavior challenges, medical challenges. This number reflects all kinds. They have taken puppies. They have taken the ones that would fly off the shelves in adoptions because we need that valve. We need to get animals out of the shelter. We are really, really full. And the capacity to care is so strained that we embrace our New Hope partnerships, and we're happy that we can work with them to place animals that are not the hard to place, but animals that can get out and can find homes. So we're really grateful to the New Hope partners. And then on the bottom, return to home is also 20%, and that's a really good, we have some excellent departments in-house that are looking to find your owners. And to all of you, if you know anyone who has a dog that is not licensed or microchip, but I really stress the license because if they wear it around their necks, it gives us like that much more information of how to return a dog, or, well, mostly dog, to their owner. That really helps. So,
a licensed dog that comes in is counted as a stray for this purpose? In other words, if a dog comes in with tags, that we log that as a stray that would go into the outcome.
yeah, well, if we don't know, if like you brought in a dog and said, I found him, but he's wearing a license, that's a stray, but then we work to reunite them with their owner, yes.
So you could measure the effectiveness of increased licensing efforts if the return to home percentage goes up.
Yeah, you definitely correlate. I would also say that with a license, there are crises in the shelter when an animal has no information at all, and then the owner shows up and we place that animal, there's some sort of placement. If we had a license on that animal, we obviously would have reached out to the owner, and I feel like we have to do a better job of explaining to pet owners that it's your responsibility too, to help us find a home for your pet. We want them to go back to your home. A license is going to get you there. So.
And Lisa also, the difference is also in the holds. If a stray animal comes in with no way to identify, then it's a 3-day stray hold. If they have a license or a chip, it's a 5-day hold. Because we have that information, we put the emotion at the trust fund.
Now, I'd be interested to see the return to home percentage, the trends over the last few years. Just wondering if they correlate to things we were doing differently. Those particular
Yeah, we're starting to look at that, and one other thing we're looking at doing that is we're getting more and more animals from people who have either been arrested or hospitalized, and I think that's part of the reason that we're seeing more return to home. So we are starting to look at those numbers.
Is there a reason for that?
And then cat placement.
Adrian, I think, doesn't answer
The
that
reason
question.
for the arrested, with the arrested people, you can't leave the animals in the house because you don't know how long they are. So right now, the way the system's set up is if someone's arrested and there's a pet in the house, the pet goes to ACC, ACC's given the name of the owner. So when they do get out, if they can't, or family member can come pick the animal up afterwards.
Is that new?
No.
I was just wondering if there's a reason why it's gone up.
And that's really what we're looking at, is to see exactly how much it has gone up. We're just trying to find out why we have so many more returned owners than we used to.
Well, it's also the information's going out more. I trained the department. I trained the department and I pushed it out more. Don't leave the animals in the apartment, especially with the sick individuals. if they're taking someone to the hospital and they're not, they may be admitted, don't leave the animal in the house. No one's coming. We just had one last week with a bird that was up in there. So it's getting information out to the officers also. So we find less animals left in homes.
And in cat placement, similar situation, a little better in adoptions, almost 50%, and new hope is at 37%. But the same applies to what I said about dogs, same thing with New Hope adoptions. And, look, 3.6% returned home of cats is really good. It used to be like, I don't even think we get 1%. It's not as common as a dog like that. Maybe if cats were licensed, that would have talked about it. And then again, just a shout out to the New Hope program and the people at ACC who run it, and all the partners. Every year we're adding partners. This year 37 of that very big list. This year 352 were active, meaning that they took at least one or two animals from us. And then what we're doing is we pre-screen for the New Hope partners. We pre-screen who could work with that. They would foster through New Hope Partner, and so we're happy to help the New Hope partners build their fosters and expedite placement. And then down below are some of the partners who have pulled the most animals in the past year. And of course, we always have to thank the ACC because they're always front and center in our partnership in animal welfare. But you can see there's a really big group, and they're great. They're great. And I feel so proud that the relationship has gotten to where it is. I know that if you go back a decade, we talked about parents life being on board. It was one of the first things about we have to resolve this, and there's so much conflict. And now it's like we all want, at the end of the day, we all want to place animals into the safety buffer. The foster program, at the gala, I'm going to say it again, like if you know anyone or if you can foster just for a week, for whatever it is, we want to get animals out of the shelter. It's a better environment to be in your home. We have such a robust program. We actually have 2 orientations for dogs and cats coming up deliberately after this board meeting because we feel like maybe we could get some interest from this room. It's just, I know members of the board, myself, it's such a great experience to foster. And to see that animal go to their next home. It's just like, I'm telling you, as a person who adopted and fostered, there's nothing like it. It's just, you will feel so happy doing it. We also have some new things, foster to foster transfers. So you foster, and then the adopter, and then the foster has like a temporary, they're going on vacation, whatever it is. Like, we want to work with you. We don't want you to be stuck like, now I can't leave my house. I have a dog. Foster to foster. So there's always a memo that goes out. I'm sure you need temporary help when you foster for a week. So that's been really helpful. And dental fosters, like just an animal comes in, they can't be in the shelter because it's so stressful. They have surgery coming up. They need to heal. And it's just like a medical foster. It's really great. I know that's how my daughter wound up adopting her dog on a dental foster. So it works.
Can we ask questions?
Oh, at the end. There's time for public comment. The volunteer program.
Just to interrupt, this is a board meeting, so our CEO is speaking to the board and updating us. It's not a public meeting in that sense that we have a public conversation at the end. Thanks for coming.
The volunteer program also a really important part of the work that we do. Part of it is just the engagement with the community, like people who are out in the community who volunteer with ACC, get the word out. And we need the help. This year, you can see, we have 630 volunteers. They've committed over 32,000 hours in the past year in 2023. We've added 206. We have some new leadership in that department, and we're really proud of it. And we're also anticipating a big turnout of volunteers when the Queens shelter opens. So we're gearing up for that, which, that'll be training for everybody, for the staff, but I think getting volunteers in Queens is going to be super helpful because we expect to get people who live in Queens. And so it's another community where we're going to grow awareness about ACC. So I just want to turn to the rest of the program. Really, it's just going to focus on what, in response to all this data and what is going on inside shelters. Well, what are we doing? We talk a lot about community, but I think at this, and we've done that for like the last couple of years, like getting into community, working in the community. We're going to have presentations from Sebastian Milanas, our Director of Animal Health and Field Operations, and John Chivalella, who runs the Resources Program. He's the director of that. And Katie Hansen, who's the Director of Marketing Communications. All to sort of like pull together, what does the community look like? What are we doing in the community? Who are we helping? What's the give and take of working with the community? And how does that improve animal welfare in New York City? We're not just trying to improve ACC. We need to improve animal welfare in New York City, and that takes a lot of work in the community. So with that, I'm going to turn it over to Sebastian, and he will present. Okay, excellent.
The intro is always the most awkward part. I hate talking about it. Second generation veterinary nurse and LBT, hired by Dr. Quinn. Literally born and bred into this. Nap times for me when I was a young kid. Raised dog cages when I worked with my dad. So coming to ACC has really been a blessing. Been here for 6.5 years. Originally hired to oversee the operations for the veterinary department before I inherited the field operations as well. And talk a little bit about kind of what we've done, Dr. Brand and I together since I came aboard, and how we've expanded that over to the field services department. A little about me, kind of on my free time volunteer stuff that I do. I'm a humane investigator, volunteer for the Suffolk SPCA, mainly for disaster response stuff that I do that I really enjoy. And I've also done some spay-a-thon in Puerto Rico with HSUS, where we spayed and neutered 1,100 animals in 5 days. A little bit of our department makeup here. It's a pretty robust staff that we have. It might look like big numbers on paper, but I think we still feel it, especially in the professional staff when it comes to vets and vet nurses. Those are the trickiest hires, especially as we're now competing in a tough space with some of these private practices that can really afford to perform. We're trying hard, we stay competitive, and every time we get within striking distance, the market changes and there's a tremendous increase. I mean, for reference, when I came out of school, tech school, I was 12, so we were paying LDTs around that time, $18 an hour. That's almost double the time, so short period of time. When I came aboard, I think one of the things that Dr. Brand and I wanted to do was really focus on the life-saving efforts. Risa mentioned how the New York department is a big sort of pathway for the animals to get out of here, but they have to incur a lot of, the ones that they're taking are the harder to place animals, the ones with medical conditions, the ones with behavioral problems. Obviously, my focus is a little bit more on on the medical cases, so we wanted to make it as easy as possible for those New York groups to, sort of front load the work that they have to do so they can pull more and save more from us. I think we've done a pretty good job of that. To the point I have to tone down the team sometimes, like, hey, let's leave something for them to do. Just referencing a couple here that we have. That to your left, the team there is performing a PU surgery where they're partially removing the urethra on a cat who had repeated urinary obstructions. That middle cat there is Kip, who we rescued from a fire with needed burn wound management. And that last one was a fan favorite named Cornbread, who was a favorite among staff, volunteers, and even the community kids department who come to visit him. In growing our department so much, we practice by the book. We don't cut corners, and that's why we've become really respected in this shelter medicine space. And we've used it as a really good recruiting tool as well. LBT specifically doesn't really exist. So we're catching them before they even have a chance to enter the job market. So that's the main recruitment tool when it comes to LaGuardia Community College, who sends us those technicians. We take as many as they'll send us when it comes to it. And we've expanded now to accepting externs from the different vet schools, which we've seen a lot more sort of come along. Cornell used to be the only one in New York. Now we've got LIU, and now we're targeting the neighboring ones. We've had We even had some students come from Brazil. They've heard of us, you know, so they'll say, hey, we want to come see you and bring stuff back. So we're really getting our name out there as a teaching institution. And with that and the notoriety that comes along with it, we're also really being embraced by our vet partners in this community. We can do so much that we can with our limitations, but now we've really, sort of a pep project in mind has been growing out these life-saving partnerships. These are just a few, Dr. Coleman, you as well, I mean, you've been also taking those few cases from us in the past few months, which those chronic cases, you know, to shout out Dr. Coleman, skin cases take forever, they're really not managed well in shelter. I think you took a pretty sick URI in one case from us.
Doing better.
Doing better, good to hear. But that just points to exactly what we're trying to do here. These have saved us tens of thousands of dollars, if not more. ASPCA, phone call away, they just sent them an amputation on the dog that came with massive fractures. So, Risa talked about the dental fosters, Heart of Chelsea. They love ACC so much that they donate a portion of the dental profits to ACC, so we don't pay for any of our dentals. Von Vet, I mean, they're becoming this huge leader in this veterinary space. The head of medicine just came through for a tour yesterday. She's a friend of mine now from just the work that we continue to do. And then that kind of like sort of sets the stage for now how we've seen, you know, we saw the shift in the veterinary department, but we've also seen the same in our field department as well. Before I coach shift to the field, are there any questions on the sort of medical side? ACC used to be, you know, animal care and control. And I think when you think of municipal shelters, you think of the dog catchers. And we know that's kind of what we used to be. And it was about getting animals in more than getting them out. And we're really proud of the work we've done where, you know, we sort of set this foundation in community and employee-focused approach to try to prevent these from even entering the care centers, but also set them up for successful leave. And we do that through the training and trying to find the compensation, every dollar that we can, that we fight for, cost saving is somewhere we can sort of shift it to people, provide them with equipment and resources that they need to perform their jobs. This year's sort of focus is really on efficiency building and data. We'll talk a little bit about data and how it's helping us right now. Lieutenant Ashby is a friend of ACC, and I would say a best friend to the field services department. Stepping over there, talks to Lieutenant Ashby and his team probably several times a day. And we're really trying to tackle this animal cruelty problem. We use it, back in June, we started capturing data to try to determine trends that we're seeing. And also, I spoke to Lieutenant Ashby last week, was, hey, like, how many of the stuff that we're reporting to you guys, because we reported based on what the law tells us to do, lead to arrest, and I don't know if you're able to get that data when it comes to ACC as your source.
I was able to get, it's not exact estimates, but we're talking about cruelty cases captured from ACC. In Brooklyn, it's about 88% increase from last year. Manhattan, a 48% increase from last year. Staten Island, 75, but that number's still low, that's a 2 to an 8. Then overall, for ACC's cruelty cases have gone to 73%. But we've seen that across the board, not just ACC. Our overall animal cruelty cases coming in from vet partners have gone up. And more likely it's because of the change in law, which requires vets to report cruelty. So since the change in law, we've seen all the numbers skyrocket when it comes to reporting cruelty.
So reporting and enforcement are up. It's not necessarily that cruelty is happening more often.